is the terminal part of the gastrointestinal tract, or you can say it's a continuation of the rectum. You see, here lies the rectum, right? And the rectum is going to be continuous with the anal canal, right? It's going to be continuous with the anal canal, where at the in front and below the tip of the coccyx, or 2 to 3 centimeter in front and below the tip of the coccyx, right? So this anal canal, it is basically situated. इसकी जो location है वो क्या है जी? It is situated just below the pelvic diaphragm. So you can see this partition, the pelvic diaphragm. I have told you about the pelvic diaphragm. Pelvic diaphragm क्या था जी? It is a partition which is going to separate the pelvic cavity from the perineum below. Okay, it's going to, this is a muscular partition which is just going to separate the pelvic cavity proper above from the perineum below. And what is the perineum then? What is the perineum then? You may not know that. Perineum is the region at the lower end of the trunk. Okay, is the perineum is a region at the lower of the trunk which contains your external genitalia, right? So what is the perineum? It is the region of the lower trunk which contains the external genitalia, right? Okay. Now, if you have a look over the perineum, so the perineum is the region basically which is related with the pelvic outlet. Okay, what is the pelvic outlet? What's this big bath? This is a pelvic outlet, right? So pelvic outlet, it is bounded anteriorly by the, the pubic arch, which is formed by the, you see, the two bodies of pubic is going to make the, in the midline, the pubic symphysis, right? So anteriorly it is bounded by the pubic arch and the inferior transverse pubic ligament, right? And posteriorly it is bounded by the coccyx or the tip of the coccyx, right? And anterolaterally it is bounded by the ischiopubic rami. This is the ischiopubic rami and the scale tuberosity. Okay? Anterolaterally it is bounded by the ischiopubic rami and the scale tuberosities, and posterolaterally it is bounded by this ligament, the strong ligament, which extends from the sacrum to the tuberosity, scale tuberosity, right? That is called what? What's the name of the ligament?
Sacral ligament?
No, it's a sacrotuberous ligament. Yeah, coming from the sacrum and going towards the tuberosity. That is the sacrotuberous ligament, right? So this arrangement of the bones and the ligaments at the pelvic outlet, it is going to give this space a diamond-shaped space. Okay, ये pelvic outlet is उसने एक diamond-shaped space बना दी, right? So if we, we are going to draw a transverse line over here, which passes to the anterior part of the scale tuberosities, right? This transverse line is going to divide this triangular space of the pelvic outlet into the anterior triangle and the posterior triangle, right? The anterior triangle, it is named as a urogenital triangle, and the posterior one is called as the anal triangle. And this, you see, this line is passing just in front of the anal canal. Anal canal will lie over here, right? So pelvic outlet, can just show you somewhere else also. You see the pelvis. Yeah, this is what the pelvic brim. This is a pelvic inlet, and there is the pubic arch, and then the tip of the coccyx at the lower end of the pelvis, right? They're going to form that part. They're going to form the pelvic outlet, right? You can see, right? This is pelvic outlet. इसके tuberosities नजर आ रही है आपको, right? Is it a pubic symphysis, the pubic arch, and then the tip of the coccyx, right? So, okay, somewhere else. I should, okay, now here you can see. This is a period of this pelvic outlet. Again, I told you before that this is formed by this arch, pelvic arch. This is an inferior transverse ligament anteriorly, posteriorly the tip of the coccyx, then the scaphoperoneum along with the scaphoperoneum, right? And then there we have to talk most of the scripture. You can see this white structure coming down over on both sides. This is the sacrotuberous ligament, right? So, and you are going to pass, we're just going to draw a line over here, just passing the anterior part of the scaphoperoneum here, like this one. Is going to divide it into two parts. The anterior one, the urogenital triangle, and the posterior one is anal triangle. You can see this anorectal junction or the here anorectal junction over here. It is just passing where it is just passing in front of this. It's just behind this transverse line. ठीक है जी, अभी आपका concept clear हुआ जी? About the pelvic outlet. ठीक है, pelvic outlet को हमने we have divided into the two triangles. The anterior one is a urogenital triangle, which consists of the urogenital diaphragm, and then the posterior triangle, which consists of this anal canal and this corrective passage. Is it clear, ji? Ki problem to nahi hai, right? Now you have an idea. So we can say that this, anal canal, it lies where? It lies in the anal triangle of the perineum. ठीक है जी? Is it clear, ji? If you problem, yes, so you can ask me, right? Okay. Now, okay. So this anal canal, it is about 1.5 centimeters in length, right? It is about 1.5 centimeter or 3.8. Sorry, 1.5 inch or 3.8 centimeters. ठीक है जी? It's about 1.5 inch or 3.8 centimeters, and it extends from where? It extends from the anorectal junction here, right? Anorectal junction. If you remember, I told you that the rectum is going to extend from the, from there. किस level से start होता है जी rectum? S3 से start होता है, and it is going to end at the perineal fracture. And what is the perineal fracture? The perineal fracture is going to represent what? It is going to represent the anorectal junction, the junction between the rectum and the anal canal when it passes through this pelvic diaphragm. Okay? And when it's going to pass from here, it is, going to make a flexure which is directed downwards and backwards. Okay, ji? Aap dekhiye, downwards and backwards, right? So this is called the perineal flexure, right? So it is directed, it extends from the anorectal junction to the external opening of the, anal canal into the anus. This is an anus, right? What is the anus? It is a surface opening of the anal canal, right? It's the surface opening of the anal canal, which extends from the, which is about, 4 centimeters in front and below the tip of the coccyx. So we have the marker over here, the tip of the coccyx, right? When we talk about the situation of anal canal, so it is situated about, that is about 2 to 3 centimeters. यहाँ से start हो रहा था ना, 2 to 3 centimeters in front and below the tip of the coccyx. And where is the anus? Anus is an external opening of the anal canal, right? Which is present in the cleft between the two buttocks, right? And it is about 4 centimeters in front and below the tip of the coccyx, right? So this is a location of the anus. So if we talk about the extent of the anal canal, so anal canal is going to extend from the anorectal junction to the anus. Is it clear, ji? The problem to nahi hai?
No, sir.
Okay, so then what is the anorectal junction? कौन बताएगा जी मुझे? It is the point where the rectum is going to be continuous with the anal canal, and it is marked by what? Right? It is marked by the forward convexity, right? The forward convexity of the perineal fracture. ठीक है जी? Is it clear, जी?
Yes, sir.
Okay. Okay. We'll talk about its relations. ठीक है जी? Well, this anal canal is, it normally remains empty, okay? Right? Okay. So its relationship. You can see this is an anal canal. Let me just show you somewhere else also. Okay. So relations may, it is related posteriorly. You see, this is an anal canal, and posteriorly it is related to this, whitish nodular structure over here. This is called as the anococcygeal body, right? This is called what? This is called as the anococcygeal body. Its name is representing that it is the, fibromuscular structure basically, which is present just posterior to the anal canal, and it extends sorry, from the anal canal to the tip of the coccyx over here, right? So I just show you somewhere else also. You can see this one. Tip of the coccyx is a whitish band structure. It is a mixed, it is a fibromuscular structure basically, which is having the incorporation of certain muscle fibers of these levator ani muscles. Okay? Levator ani muscles, which fibers they are going to be incorporated in it, right? And it extends from the posterior aspect of the anal canal, also start of that, and it's going to be tied towards the tip of the coccyx, right? So that's what it's called as the anococcygeal body, that extending from the anal canal up to the coccyx. Okay, so posteriorly it is related with this anococcygeal body, right? Okay, and here you can see this anal canal over here. An anal canal, it is related with this, fatty structure over here, right? And this space, which is filled with the fat on both sides of anal canal, it is called as a schizorectal fossa, right? So anal triangle, maybe we have got the central, maybe we have got this anal canal, right? And then on the both sides, we have got this schizorectal fossa, which is filled with the fat, right? So posteriorly, it is related to the anococcygeal body, and laterally, it is related to the fat-filled schizorectal fossas, right? Okay. So okay. Now anteriorly, this anal canal is related to a fibronodular structure over here, right? That's called the perineal body. Okay, in front of the anal canal here, there is a fibronodular structure that is called as a perineal body, right? And this perineal body, it is going to receive the certain muscle fibers, right? About 10 muscles, they are going to converge over this body, and this perineal body is basically present is occupying the central position in this pelvic diaphragm, because it is going to give stability, right, to this anal canal, right, in this region. So, or support to this region. So this perineal body, it is what? It is a fibronodular structure, right, which is occupying the central position in the pelvic diaphragm, located just in front of the anal canal, right? So anteriorly, it is related, both in the cases of male and female, we have got over here, that is a perineal body, right? And then in front of the perineal body over here, this area that I told you that this is called as a urogenital triangle, right? So this urogenital triangle, it is filled by covered by this urogenital diaphragm. Okay? And again, if it's a diaphragm, so it's a partition, right? So this partition is again made up of the certain muscles, right? So that's why I told you, like, this perineal body is going to receive the muscles which are getting origin from the periphery, and they're going to be, having their some of these muscles having their insertion, or they're incorporating their fibers to this perineal body in this region, right? So anteriorly we have got this perineal body, and then we have got this urogenital diaphragm again, which is a muscular partition, consists of all 6 to 10 muscles. Okay. Okay. In case of the male, anteriorly here. In the case of the male, you can see here anteriorly again. This is a perineal body. These are muscles which are going to form the urogenital diaphragm over here, right? And then the bulb of the penis, right? In the case of the male, the bulb of the penis is there, and the membranous part of the urethra, right? Whereas in cases of the females, we have got over here. You see, there is a lower end of the, lower part of the vaginal canal, right? The lower part of the vaginal canal is this perineal body, and then these are muscles forming the urogenital diaphragm, and then the lower part of the vaginal canal present over there, right? So these are the structures which are present in anterior relation to the anal canal. यहाँ तो problem तो नहीं है बच्चे. Okay. There are certain structures you see, the region of the perineum and the about which we are going to talk about when we are going to talk about the pelvis and the perineum, right? Also, you'll be having the much details of the urogenital diaphragm. Focus muscles जो है urogenital diaphragm बना रहे हैं, right? So then you have a better idea. I'm just going to give you a brief introduction so that you can understand at this level that what are the relations of the inner canal in the perineum. ठीक है जी? Okay. Now we'll talk about its about the mucous membrane or the internal structure of the anal canal. So if you have a look over the internal surface of the anal canal, right? So the anal canal, it is divided into the two parts, the upper half and the lower half. Okay? This is an upper half of the anal canal. Here this line is going to demarcate the anorectal junction, right? You see, anorectal junction. You can see the rectum. This is the rectal ampulla, and when it is going to continue with the anal canal, it's suddenly becomes narrow. Okay, it suddenly becomes narrow and is going to be continuous with the anal canal at the anorectal junction, right? This is the region of the perineal fracture also, right? So if you have a look of the internal structure of the anal canal, so we are going to divide the anal canal into the two halves, the upper half and the lower half. ठीक है जी? The upper half, the epithelial lining, right? The mucosal lining is that is lined by the columnar epithelium, right? Right. The mucosal lining is lined by the columnar epithelium, and here you can see it is representing by these 6 to 10 vertical folds all around the anal canal, right? All around the anal canal. There were total 6 to 10 vertical folds, and these are called as the anal columns. ठीक है जी? Upper half of the anal canal में we have got about 6 to 10 vertical folds of the membrane. And these are called as the anal columns or the anal columns of the Morgagni, right? Okay. And at the lower end of these columns, these are joined by these folds of the mucous membranes, right? These are called as the anal valves, right? These folds of the mucous membranes, which are just going to join the lower end of these columns, these are called as the anal valves. ठीक है जी, कोई प्रॉब्लम तो नहीं है? Anal columns, anal valve में कोई प्रॉब्लम तो नहीं है? And a bit above each anal valve, there is a depression. ठीक है? हर anal valve के ऊपर you can see the depression, and this is called as the anal sinus. This depression is called the anal sinus, right? And this anal sinus. यहाँ तो बात clear है जी? Okay. Now, this part, upper half of the anal canal, it is endodermal in origin. Okay? So it is going to receive its nerve supply. Okay? Its nerve supply is basically received from the autonomic hypogastric plexuses, right? And this part of the anal canal, it is sensitive to the stretch, right? The blood supply of this part, that is being derived from the superior rectal artery. If you remember, I told you the superior rectal artery, after running on the posterior surface of the rectum, right, it is going to divide into multiple branches on both sides, and then it is going to pierce the the muscular coat of the rectum, and then it runs between the mucous membrane and the muscular coat. उनके दरमियान में run करती हैं, right, and then they are going to supply up to the region of the upper half of the anal canal. So here, this structure, this area, upper half of the anal canal, it is going to receive its blood supply from the superior rectal artery. The superior rectal artery is basically the continuation of the inferior mesenteric artery. Remember, ji, yaad hai aapko? Well, the lymphatic drainage of this region, again, it is going towards the, through the pararectal nodes, they are going towards the inferior mesenteric group of the lymph nodes. Okay, ji. Now we'll talk about the lower half. The lower half का जो epithelium lining है बेटा, जो mucosal lining है, that is lined by the stratified squamous epithelium non-keratinized. ठीक है? There are no valves in it over here, right? There are no valves, right, in the lower half. And the lower part, it is going to merge at the anal opening with the perianal epidermis, right? Just anal opening के साथ जो skin है, right? So it is going to be merge at the anus with the perianal epidermis. ठीक है जी? Skin के साथ ही आगे. It is just going to, right? So this part, this is an ectodermal analogy, right? So it is going to receive its nerve pair, which is not autonomic. That is what? That is the somatic innervation, and that is basically contributed by the inferior rectal nerve. ठीक है जी? कोई प्रॉब्लम तो नहीं बच्चे? So the lower half, it is divided. The difference क्या होगा जी? That is lined by the stratified squamous epithelium non-keratinized. Secondly, it is going to, it has got no anal columns, right? And it's not trapped with the somatic nerve, somatic system, and that is through the inferior rectal nerve. So if it is having the somatic nerve system, so it means that it is sensitive to the pain, touch, temperature, pressure, right? And its blood supply is basically derived from the inferior rectal artery, right? Inferior rectal artery is the branch of the internal pudendal artery, right? And its lymphatic drainage, of course, it is going towards the medial group of the inguinal, superficial inguinal lymph nodes, right? Okay. Now, here you can see there is a line of junction between the upper half and the lower half, right? Upper half and lower half, the point of line of junction, you can see here these anal valves, these are going to form a transverse line, right? This transverse line, which is named all around the anal canal, right? And this is called as the pectinate line. And this pectinate line, it is just going to represent the line of junction between the upper half and the lower half, or the endodermal half with the ectodermal half. ठीक है जी? Is it clear? यहाँ तक बात clear है जी?
Yes, sir.
Okay.
Yes, sir. Last वाला repeat कर दें.
You means pectinate line का जी? I was telling you बेटा, मैंने बताया ना कि इसके दो हाफ है ना, right? इसका एक upper half है, इसका एक lower half है. उन दोनों हाफ में एक लाइन ऑफ जंक्शन तो होनी चाहिए ना, लाइन ऑफ सेपरेशन तो है ना, कि ये यहाँ से ऊपर अपर हाफ और यहाँ से नीचे लोअर हाफ. So this line of junction, you can see these anal valves, these are going to make a transverse line all around the anal canal, right? This transverse line over here, this is exactly sort of a transverse line. It is called as a pectinate line, which is representing the junction of the upper half of the anal canal with the lower half of the anal canal. The junction of the ectodermal part of the anal canal with the endodermal part. ठीक है जी? और ये जो लाइन है ना जी, pectinate line, it is just present opposite the mid of the internal anal sphincter. ठीक है ना? As far as the anal canal is concerned, तो बेटे इसके दो sphincters होते हैं. इसका एक internal anal sphincter है और एक इसका external anal sphincter है. ठीक है जी? Internal anal sphincter, that is the involuntary, and the external anal sphincter, this is the voluntary, right? It's another voluntary control. So this pectinate line, it lies about at the mid of the internal anal sphincter. This is an internal anal sphincter. This one. ठीक है जी? यहाँ तक बात clear है जी? Okay. When we talk about the muscular coat of the anal canal, अभी तो हमने mucous membrane और इसका internal structure देखा ना जी? No, just if you're going to have the this is basically the coronal section. So here you can see the walls of the anal canal. We have got the two types of the muscles. the outer longitudinal muscle and the inner circularly arranged muscle. ठीक है, ये inner circularly arranged muscle है and the outer longitudinal muscle. Those bands are. One is coming from the, these longitudinal muscles are contributed from the longitudinal muscular cord of the rectum over here, and certain fibers, these are incorporated from the levator muscles in this region, right? Well, so if you have a look over the wall of the anal canal, so it is having the two layers of muscle. The internal one, this one is the circular smooth muscles, and the outer one is the longitudinal smooth muscles, right? Okay, so these muscular arrangement, it is going to form the two sphincters. This circular one here, the circular muscles, smooth muscles which have got circular arrangement, right? The inner aspect, they are going to form the internal anal sphincter. ठीक है, जो circular muscles है ना दोनों साइड पे पीछे, ये क्या कर रहे हैं? These are thickened, and the thickening of these smooth muscles in this region, they are going to form the internal anal sphincter. With the internal anal sphincter, it extends, it covers about upper 3/4 of the anal canal. You can see this one. ठीक है, जो सारी सारी लेंथ में ये स्मूथ मसल्स नहीं होते जी, internal sphincter नहीं होता, right? So internal sphincter, which basically consists of the circular smooth muscles, these are going to occupy the upper 3/4 of the anal canal, right? And this is what? This is the involuntary. And this internal sphincter, it is enclosed by the strip of the enclosed by, you see, enclosed by this longitudinal muscles, just striped from here, right? And these longitudinal muscles, right, these are going to form the external anal sphincter, right? Right, this is going to form the external anal sphincter. Is it clear? And the external anal sphincter, it is going to occupy the whole of the length of the anal canal, right? So we will repeat it again. That anal canal, it has got two sphincters, the internal anal sphincter and the external anal sphincter. The internal anal sphincter, it is formed by the inner circular thickening of the inner circular smooth muscles, right? And it is going to extend to only up to the upper 3/4 of the anal canal. Whereas on its exterior, it is covered by this. It is enclosed by the striped muscles, or longitudinal muscles over here, which is just going to extend to the whole length of the anal canal, right? No, this external anal sphincter, which is this longitudinal muscle fiber coming down over here, and is going to close this internal sphincter, and is going to cover the whole of the length of the anal canal. So it is divided into three parts. The first part is called as a subcutaneous part. This one. ठीक है जी? Subcutaneous. Its name is representing just below the skin, right? It's called a subcutaneous part, that is called as the skin, below the skin. Just behind the skin, right? So this is the subcutaneous part. And after that, it is followed by the second part, that is called as the middle part, or the superficial part of the external sphincter. This one. Okay. Right? This is the subcutaneous part, and this one is the superficial part, and it is followed by the third part, that is called as the deep part, right? And you can see the subcutaneous part, it is going to enclose or occupy the region, that is, it's going to encircle the lower end of the anal canal. Okay? And the deeper part, it is going to encircle the upper end of the anal canal. Is it clear, ji? Koi problem to nahi hai? Okay. There is certain important one thing more I just want to show you. Okay. This is schematic presentation of the external anal sphincter. The external anal sphincter, I told you that it is going to have three parts. We are going to divide in three parts. And इसका purpose क्या है जी? External, this is what it's under the voluntary control, right? And it can keep the anal canal closed. Is it or not? So it is going to, that's why it is present along the whole length of the anal canal. So it's a voluntary nature, right? and it's under the control of the somatic nervous system, and then its purpose क्या है? It's going to keep the anal canal closed, right? So voluntary control method. So what we can see, okay, so it has got a three parts. So again, I'm going to repeat it. The lower one, which is just near the skin, that is called as a subcutaneous part. And this subcutaneous part, I told you that is going to enclose the lower end of the anal canal. And it has got no bony attachment. Okay? It is just a circular muscle fibers which are present around the lower end of the anal canal, right? Okay. The second one is called the subcutaneous superficial part, right? And this superficial part, it is having its attachment anterior to the perineal body. मैंने आपको बताया था ना कि एनएल कैनाल के एंटीरियरली क्या स्ट्रक्चर पड़ा हुआ है जी, पेरिनियल बॉडी इज अ फाइब्रोमस्कुलर ड्यूल which is इसका पर्पस क्या है? It's going to give this support to this anal canal, ठीक है ना, to hold this anal canal in its place, right? And secondly and posteriorly again the fibromuscular body over here that is called as the anorectal body, which is going to attach this anal canal with the coccyx to give, again the purpose is to give the support to hold that anal canal in its place, right? It's going to be stretched between the perineal body and the anococcygeal body. So the superficial part, it is going to have its, attachment on the anterior to the perineal body and posteriorly through the anococcygeal body to the tip of the coccyx. Is it clear, Ji? And the third part, which is a deeper one, and you can see again, it is not going to have any of its, bony attachment. Again, circular muscle fibers which are just going to hold what? Encircle the upper end of the anal canal. ठीक है जी, यहाँ तक बात clear है? Okay, now to hold this upper end, this anal canal in its position, the nature has designed and other muscle fibers, and these are called as the puborectalis fibers, right? These puborectalis fibers, these are basically the fibers of the levator ani muscles. The levator ani muscles, I told you before, beta, कि ये वो muscles हैं which is going to form the sorry, it is going to form the pelvic diaphragm. I'll just show you. Okay, आप ये देख सकते हैं, this is the pelvic diaphragm which is going to separate the pelvis from the perineum. This is a perineal view, right, of the outlet. Internal aspect से देखेंगे. Okay, here, right. So these muscles, the muscles which are extending from the pubic bone here, and then from the subcutaneous fascia, right, and fibers coming from the ischium, right, and the ilium, right. So these fibers here, right, the puborectalis fibers, the pubococcygeus fibers, right, and the iliococcygeus fibers, right. So these fibers, these are going to form what? This partition. This is called as a pelvic diaphragm, and the muscles which are going to contribute these fibers, these are collectively named as the levator ani muscles. Okay, so the puborectalis fibers, these are coming from the pubic bone, and they are going to make a sling around the anal canal, right? And they're again going to be attached over, right? दोनों यहाँ साइड से आएंगे और यहाँ पे इसके they are going to make a sling around it, right? And this, due to this sling, हमने कहा था ना ये perineal fracture बनता है. Due to the pull of these muscle fibers, the perineal fracture is formed, so that you see the anterior and the anterior convexity of the anal canal, right? That is a perineal fracture. So आपको now you can have a better idea कि जो perineal fracture बन रहा है, it is due to the pull of these puborectalis fibers. Again, इसका क्या purpose है जी? It is going to क्या करेगा जी? To hold it in its position, ठीक है? This is backward pull इसकी आ रही है from the anococcygeal body, right? और यहाँ से it is going to make a pulley or the sling around the anal canal. ठीक है जी? तो
Yes, sir.
यहाँ पे आपको एक और चीज दिखाते हैं जी, so that के जो schematic presentation है ना, उसमें it's very better. आपको नजर आएगा कि किस तरह वो is going to make a sling, and you see is going to make a sling and pull this upper half. This is an anorectal junction, right? And this is going to form the anterior convexity of the perineal fracture. Is it due to the pull of this puborectalis fibers? Is it clear, Ji? Okay. Other than this puborectalis, these puborectalis fibers, okay, you can see. ये आ रहे जी fibers, ठीक है जी, levator ani muscles. Okay, other than that, the longitudinal muscle fibers, यहाँ पे होते हैं, I just showed you before. This is continuous above with the rectum. And they are going to make a continuous cord around the anal canal, right? And they descends between the internal anal sphincter and the external anal sphincters. ठीक है जी? You see these fibers. Other than these puborectalis fibers, we have got these longitudinal layer muscle fibers which continues above from the rectum. ठीक है? And it is going to descend in between the internal anal sphincter and the external anal sphincter, right? And there, you see, some of the fibers are going to come over and going to be attached towards the mucous membrane of the anal canal, and the others pass laterally to the skin, right? ठीक है जी? Now, the three things: this internal anal sphincter, right? And this puborectalis fibers coming down over here, and this deeper part, this region basically. This region is going to form an anorectal ring, right? Anorectal ring, which you can feel when you are going to perform the perrectal examination, right? Sometimes we have to perform this, if the patient comes to you with the complaints of certain, bleeding and the, hemorrhoids and certain things, then you have to perform, PR examination, perrectal examination. On that PR examination, you have to push your finger inside and you just can, feel that is there any mass or any, fissure. Or, so for that, external examination, you can feel that anorectal ring, and this, thickening or the anorectal ring, which you can feel on the PR examination, it is basically contributed by the, this area where the three muscles, the deeper part of the external sphincter, the puborectalis fibers, and the internal anal sphincter fibers. They are going to form the anorectal ring. ठीक है जी, यहाँ तक प्रॉब्लम तो नहीं है. Okay, बच्चे, now we talk about the blood supply of the anal canal. Anal canal, I told you before that we are going to divide into the two halves, upper half and the